Really bad side effects from chemo, not always a bad thing. Hi there, my name is Dr. Walter Lemo, naturopathic physician who has a practice solely focused in cancer care for over 20 years. I was recently talking to a patient where, they began some strong chemo treatment, I guess, or ones that tends to have side effect. And they reported actually it sent them to the hospital where like the hemoglobin dropped. I can't remember if the platelets dropped as well. And then they later had some other complications. So obviously, when you're looking at that kind of picture, it doesn't look good. It reminds you of the potential toxicity of chemotherapy. Not all of them, but there's groups to be aware of. However, there's another point to also consider um, that I discussed with this patient. Because then when we looked at the question I asked was, just out of curiosity, how do you know how you responded to this treatment? Like in terms of any signal that what happened to the cancer? And sure enough, when we're just looking at some blood tests, they're called tumor markers. They were like, say, way up here and bang, and they slammed way down over here. So what I've learned is throughout my career is that we have to keep in mind that cancer that grows inside you is from you. So that means just how you are sensitive to the drug treatment, the cancer could be just the same. And so I've definitely seen a group of patients where, if their bone marrow really drops or their platelets really drops, it's a signal because I've seen conversely those patients to actually do quite well as well. And that's the group I find that really needs naturopathic medical support, to try to help their body out to handle those kinds of hits because they're more uniquely chemotherapy sensitive. And so, like, for example, the classic intravenous vitamin C that conventionally they always question, like that group is made for those kinds of tools, I've found, and other approaches as well. Like, can't go wrong with acupuncture and other things as well. But, anyways, I just want people to know that. And so, that for me could also be a signal. So, while yes, you have to respect the chemotherapeutic drugs, yes, they can kill you, and yes, they could lead to other problems. But on the flip side, there is that group that the cancer responds just as dramatically and it can shrink just as dramatically. And if they get the right support, it tends to handle the storm a lot better.